This is a book review on The Cost of Cutting. A Surgeon Reveals the Truth Behind a Multi-Billion-Dollar Industry by Dr. Paul Ruggieri. Practices change in healthcare daily, weekly, monthly, and even yearly. The healthcare system is so vast and advances so quickly, it is difficult for consumers and patients to understand exactly where their healthcare consists of and the pricing behind it. This book reflects on why there are high cost discrepancies amongst hospitals and surgical centers from a business standpoint and the importance of transparency that patients need to advocate for regarding their surgical journey. The book starts out reflecting on how surgeons are reimbursed. The reimbursement process is based on surgical procedure, the outcome of the procedure, including high risk factors, and who's paying the bill. For example, if Medicare is paying the bill, private practice surgeons will see, and even hospital surgeons will see less money than if a private insurance company is paying the bill, which is why private practice surgeons can cherry pick their patients based on insurance type and what procedure is needed and the risk factors that might involve that surgery. Next, the book reflects on independent surgeons owning their own private practice versus hospital physicians and the competition that they have with the surgeons who are employed by the large hospital organization. As Dr. Ruggieri mentions in his book, quality of life for hospital surgeons can be more intriguing than owning your own private practice because you're not competing for a spot on the private practice team. You don't have to build a private practice up from the ground up. There are less hours to be worked, and when you're done with that patient, you can pass the patient on to the next physician coming on the clock. But this is where patient experience might come into play within a hospital. These factors can make it worthwhile for new surgeons right out of med school go work for a hospital, which might slowly dissolve the private practice surgeons and over time. This bridges us into the cost you might pay in a hospital versus what you would pay for a private surgeon in a hospital or surgical center. The cost of supplies is becoming a crucial part in hospital payment. Insurance companies are cracking down on the overuse of products and supplies. Surgeons need to be mindful of what they are using. Patients should be asking for transparency in healthcare and what their bills mean and where those prices are coming from. Patients should want to understand what they are paying for and what their health insurance is paying for. Because standardization doesn't exist when it comes to pricing of supplies, surgical space, surgeries, post-op care, pre-op care, etc. across the board, it's really important that we as patients start advocating for that standardization and know what we're paying for and why. The book gives an example of tier 1 hospital physicians only refer patients to tier 1 surgeons, and this is all driven by cost. Cost is such an unknown factor in the surgery and healthcare world. Lastly, the book dives into payment. Most surgeons, except for plastic surgery patients or plastic surgery physicians, are only paid after the job is done. This can take weeks to months to be reimbursed for the surgery that you did, especially if Medicare is paying for it, because they need to make sure that the documentation is accurate. Plastic surgeons can be paid up front because these surgeries are elective. Picking a surgeon and where to have surgery can be a difficult choice. It is difficult because people do not have the knowledge base and the lack of people don't have the knowledge base, and there's such a lack of transparency from hospitals and insurance companies regarding bills. It can be frightening. Dr. Ruggieri brings the end of the book with a great question, and I'm going to leave you with this question. What is a good surgeon worth to you?